personal health record is a lifelong tool for managing health information, such as diseases, allergies, surgeries, and relevant information. It is a private, secure application in which healthcare providers may access patient information. Now let's watch this scenario.
Hey there, I'm Sarah. I'm going to be your nurse today. What's your name?
Cindy.
Cindy?
Flower.
Cindy Flower. What's your date of birth?
426.
Okay. I've got to do some admission papers on you, so I've got to go get the chart, and I'm going to come back, sit down, and go over some stuff with you, okay? All right, I'll be right back. Hey, Cindy. Tell me what brought you here today.
Well, I have CHF, and I'm on vacation down here, and I went out last night and had some margaritas and chips and salsa and some tequila, little things like that. And this morning when I woke up, I was really swollen all over, especially my legs and feet.
Okay. Did you take your medicine tonight?
Well, I forgot my medicine, so I haven't had it in 4 days.
Okay. Let me ask you this first. Who do you want to list as an emergency contact person?
You can list my mom, Nancy.
Okay. What's her phone number?
912-729-5833.
Okay. Who's your primary care doctor?
It's Dr. Smith. His first name starts with an S, but I don't know.
He's in Atlanta?
Atlanta.
Okay. Any specific area, Buckhead, or anything like that?
It's around, like, where the Georgia Tech College, around in that area, downtown.
Okay. Let me ask you this. What other kind of medical history do you have, other than the congestive heart failure?
Well, I have my sugar's high, and then I have some anxiety and high blood pressure, and they got me on a water pill, and then I've had a cough recently, so I'm taking something for that too, augmentin for the cough.
Okay. Okay, so let me just get all your medications that you take on a regular basis. Okay. So you're taking augmentin? How many times a day?
I take that 4 times a day.
Okay. Do you know what the dosage is on that? How many milligrams?
I think it was 250.
Okay. And you said you take a water pill? Do you know if it's Lasix or?
I'm not sure.
You're not sure? You
It's
take
a little
once
white
day?
pill.
Okay.
Once a day.
Okay.
And then I take something for blood pressure. It's like a blue pill. I take that one twice a day.
Okay.
And then I take something for my sugar.
Okay.
Once a day.
So you take a blood pressure medication, water pill, you're not sure what it is, a blue pill for your blood pressure, you take augmentin for what? What was that for?
The cough.
For the cough.
Yeah.
Okay.
And then I have some other pill that I take for anxiety that I take at night.
Okay. Okay. Doctor's name is F. Smith in Atlanta. Okay. I'm going to see if I can locate that physician so I can find out what medications you use. Actually, do you know what pharmacy you use in Atlanta?
Walmart.
Walmart. Okay. Do you know what road Walmart's on? Or do you know their phone number?
I think it was on Green Street.
Okay, Green Street. Georgia. Okay, I'm going to go ahead and see if I can find out what medications you take, and go from there, okay?
As a healthcare provider, it's not easy to obtain medical information. It is often incomplete and at times incorrect. Let's see how the personal health record can help prevent this situation.
Hey there, I'm Sarah. I'm going to be your nurse today. Can you tell me your full name and date of birth?
Cindy Flower, 4265.
Okay, great. Cindy, can you tell me what brought you here today?
Well, I have CHF.
Okay.
And I went out last night and had some margaritas and some tequila and some salsa and chips and stuff. And when I got up this morning, I was just very swollen.
Okay. So you're here from Atlanta. Who's your primary doctor?
Dr. Smith. His first name starts with an S, but I'm not sure what it is.
Okay, let me see if I can find it here. Got you in the system. And Stephen Smith, is that his name? Okay, that's who we have him listed. We have him listed for you. So you take medications. Did you say you forgot your medicines at home?
Yeah, I haven't had them in 4 days.
Okay. What do you normally take?
Well, I have something for blood pressure.
Okay.
I think it's a blue pill that I take twice a day.
Okay.
And then I take a water pill. It's a white pill that I take once a day.
Okay.
I take something for my sugar, and I take something for anxiety at night. And then I've had a cough and stuff for the last 2 weeks, and they have me on augmentin for that.
Okay. Let me see if I can pull up the medicines that you take on and tell me if this is correct. Looks like here they have you on amoxicillin 250 milligrams 3 times a day. Is that correct? That's the antibiotic. Okay. And then you're on Vasotec, it's a blood pressure medicine, another antihypertensive, metoprolol, and then they also have you on Lasix, which is the water pill. Okay. Okay. And the Lasix, it says you just take once a day. That's the water pill.
Mm-hmm.
And then they have you something on anxiety. It's called Xanax. And you take one of those. You can take as needed, like, every 4 hours. Does that sound about right?
Yeah, I usually just take it at night.
Okay. Okay. So you don't have your medicines today, so. I'm going to go talk to the doctor. We're probably going to go ahead and get you some IV medicine. That's like the water pill. Give that to you to get some of that fluid off today. And you'll probably be admitted, and you'll be here overnight probably just to get that under control. And then we'll send you back home to Atlanta, and you go back and see Dr. Smith and follow up with him, okay?
Thank you.
All right.
Patients preparing for surgery are required to undergo testing to ensure safe procedure. Many of these tests are performed at different facilities. The results for these tests must be gathered prior to the surgery. Let's look at this next scenario.
Knock. Hey there. Hey. I'm Sarah. I'm going to be getting you ready for surgery today. Can you tell me what your name is and your date of birth?
Cindy Flower, 4265.
Okay, great. Thank you so much for coming in early. We had a couple cancellations, so we wanted to go ahead and get you in, okay? They're going to send you to get blood work, chest x-ray. Did they go do that?
Yeah, I did that yesterday.
Oh, you did that yesterday. Okay. I hadn't seen any results for that yet, but I'm going to have to go take a look and see if they're on our fax machine. And if not, I'm going to have to call around a little bit. When's the last time you had anything to eat or drink?
2 days ago.
Okay, 2 days ago. Okay, so you haven't had anything. Okay, and what are you allergic to?
Amoxicillin and codeine.
Okay, great. Okay. Let me ring out and see if those are on our printer, and I'll come back in and let you know, and we'll try to get this going, okay?
Okay.
All right.
Really? Call me?
Okay. Just to give you a little update, I just had to call the lab, and I called radiology because we didn't have the report or anything on our printer, so they're going to fax it over as soon as they can. They have it in there, but we don't have the results yet, so we're waiting on those. Can't do the surgery until we get those,
How long is this going to take?
It shouldn't take long. I just got off the phone with them, so they should go ahead and send it. Did you happen to give them a urine sample this morning when you came in?
Yes, I did.
Okay, so I need to check and make sure. Did they do a pregnancy on that? Do you know?
I don't.
Okay, I'll check that, and I don't see that you have consent forms signed because you were supposed to have those done also.
I already did that. I did that when I came and pre-registered.
Okay.
Yesterday.
I'll have to look and see if that's in there, but I don't see that here, so I'll go ahead and get that done also, and I'll be back in just a few minutes, okay?
Hey, yeah, I'm sitting in here. They call me to come in early, and then they have nothing ready. I mean, it's ridiculous. I know. I mean, I could have stayed at home and. All right, gotta go. Here she comes.
Okay, good news. You're not pregnant, so that's a good thing. You can go ahead with surgery for that.
Well, that's good.
Okay, and oh, they're here. Okay. Oh, they just said that the chest X-ray and the labs just came in, so I'm gonna take a look at those, and then the doctor should be able to take you back, just a few minutes as long as everything's normal. Okay.
Okay.
All right. I'll be back.
An inability to obtain this information can lead to patient frustration, lack of confidence in the staff, and possible delay or postponement of the surgery. How will the PHR change this situation? Let's watch.
Hey there, I'm Sarah. I'm going to be taking care of you this morning, getting you ready for surgery, okay? Can you tell me what your full name is and date of birth?
Cindy Flower, 4265.
Okay, what are you having done today, Cindy?
I'm having surgery.
Okay, great. What kind of surgery are you having? Having a colonoscopy?
Colonoscopy, yeah.
Okay, perfect. Just making sure you know what you're here for. They were going to send you for some labs and chest x-ray.
I had all that already. I had it yesterday. I haven't eaten in 2 days, and I'm sorry if I'm a little cranky, but I'm ready to get this over with.
Oh, I understand that. 2 days. Well, we have an electronic health record here, so everything should be right online. I should be able to pull everything up real quick, and then we'll get you back, okay? As soon as you get done, we'll get you up to date. Okay. See that your pregnancy was negative. Looks like all your labs are good, and chest x-ray looks completely normal. So everything looks normal. Looks like your consent is actually on the chart, and your history and everything's on there. So it looks like we're good to go. Okay. So I'm going to go ahead and let the doctor know that we're ready, and we're going to get you on back. Okay.
Thank you.
Shouldn't take too long. The procedure's about 30-45 minutes, and then we'll get you something to eat. Okay.
Thank you.
All right. Great.
Through the use of networking technology, patient results can be accessed via the personal health record. The personal health record network is a compilation of information obtained from multiple locations. In the next scenario, let's see how the personal electronic health record plays a role in prevention and errors in healthcare.
Hey, Cindy. Doctor ordered some Phenergan for your nausea. Okay.
All
Do you want to make sure you said you're allergic to codeine and amoxicillin?
I've told you twice. Yes.
All right. Just want to make sure that that's all that you're
I just
allergic
need
to.
something. I'm just so nauseous.
All right. Let me go ahead and give this to you.
What? Oh my God. What is this? Oh, what did you give me? Oh my God. I can't breathe. What did you give me?
What else are you allergic to? You told me just codeine and amoxicillin.
What'd you give me? Phenergan. I'm allergic to Phenergan. I
gave you
told you
Phenergan.
that. Oh my God.
All right. Let me go talk to the doctor.
We should leave.
Medication administration errors count for 98,000 deaths per year. Now let's see how the electronic personal health record can help prevent these errors.
Hey, Cindy. How you doing?
Are you ever going to give me anything for nausea? I feel terrible.
Okay. Well, you didn't ask me for anything for nausea earlier, so I can check. Let's see. What have you taken in the past?
Phenergan works. Can you give me some Phenergan? I'm just taking Phenergan.
Okay. You know what? I'm looking at your personal health record here, and it says that you had an allergic reaction to Phenergan about 2 months ago. So I'm going to go ahead and talk to the doctor about getting you some Zofran instead, okay?
Well, just
Okay.
Thank you.
In the last scenario, the patient was able to update her personal health record prior to traveling, which allowed the healthcare provider access to accurate patient information and prevent a medication error. The benefits of the personal health record are that each person is in control of his or her own medical record. The information is gathered over a lifetime and is safe and secure. The personal health records are accessible from anywhere at any time. In the future, the electronic personal medical health record will be the standard for patient information. Thank you for watching.